Hello, Cretex family. This is Linnea Ritter. I am the family nurse practitioner at the Be Well Health Center. Thank you for taking out time from your busy schedule to watch the November 2022 blood pressure information webinar. The Be Well Health Center is partnering with Cretex to provide a virtual activity to raise awareness and promote early screening for hypertension or elevated blood pressure. Before we get started with the presentation, just a few words about Marathon Health Centers. Marathon providers are trained in the art of health coaching. Our goals are to help identify health risks before they have become disease states and help mitigate that risk through lifestyle and medications if needed. Managing health issues once they start can often reverse adverse effects as the human body is resilient. Marathon's philosophy is to empower each individual to gravitate toward healthy behaviors. There are many ways to get there, and research on health coaching indicates change comes from within. Providing educational tools and support along the way is more effective than dictating a cookie-cutter plan, as everyone is unique in what works for them in their health journey. There is much to cover in this 20-minute video, so let's get started. The agenda: blood pressure basics, risk factors, reduce your risk, and next steps. The content of this presentation, including any handouts, is for educational and/or informational purposes only and is not intended to be a substitute for professional advice, diagnosis, or treatment. Always seek the advice of a qualified professional with any questions or concerns you may have. What is blood pressure? Blood pressure is the measure of how hard your blood is pushing against your artery walls. You can think of water traveling through a garden hose. When it's at a trickle, there would be low pressure on the hose. But when it's going full blast, a lot of pressure is exerted. Systolic blood pressure, the top or the first number, represents how much pressure your blood exerts against your artery walls when your heart beats. The diastolic blood pressure, which is the bottom or second number, represents how much pressure your blood exerts against your artery walls when your heart is resting between beats. Normal blood pressure is anything that is less than 120/80. To be considered normal, your blood pressure must be 119/79 or less. You are considered to have elevated blood pressure if your systolic level is between 120 and 129. In this stage, diastolic pressure is still 79 or below. Stage 1 hypertension is when your systolic is between 130 and 139 and your diastolic is between 80 and 89. And stage 2 hypertension is anything equal to or greater than 140/90. When your blood pressure is in the normal range, it's recommended that you practice heart-healthy habits like healthy eating and regular exercise. If you've got elevated blood pressure, you're likely to develop high blood pressure unless steps are taken to control the condition. When you've entered into the stage of hypertension stage 1, your numbers are consistently in that upper range. This is the point at which your doctor may prescribe lifestyle changes and may consider medications. And when you hit hypertension stage 2, your numbers are consistently in that upper range of 140 or greater and 90 or greater. This is when your doctor is likely to prescribe a combination of lifestyle changes and medications. If your blood pressure readings suddenly exceed greater than 180/120, this is considered hypertensive crisis. If this happens, wait 5 minutes and test again. But if your number is still high, it is recommended that you contact your doctor. According to the American Heart Association, if your blood pressure is higher than 180/120 and you are experiencing signs of possible organ damage such as chest pain, shortness of breath, back pain, numbness or weakness, change in vision, or difficulty speaking, do not wait to see if your pressure comes down on its own. Call 911. Many factors play a role in the insidious onset of elevated blood pressure. The danger is there are no obvious symptoms that signal it is happening until the blood pressure is already too high. Risk factors. If your parents or other close blood relatives have high blood pressure, there is a good chance you'll develop it too. The older you are, the more likely you are to have high blood pressure. Until age 64, men are more likely to be diagnosed with high blood pressure. But at 65 and older, it shifts to women being more likely to be diagnosed with high blood pressure. African Americans are also more likely to have high blood pressure, especially severe high blood pressure. Several lifestyle habits also affect blood pressure, including physical activity, nutrition, alcohol consumption, tobacco use, and how well someone manages their stress and their weight. Reducing your risk. Ways to reduce your risk of high blood pressure include maintaining a healthy weight, eating healthy, such as the DASH diet, which we'll review in a minute, getting plenty of physical activity, managing your stress well, and quitting tobacco. Maintaining a healthy weight is one way to prevent and improve high blood pressure. Carrying too much weight puts a strain on your body, including your heart. Being overweight puts you at higher risk for high blood pressure, cardiovascular disease, and diabetes. But losing just 5 to 10 pounds can have a positive effect on your blood pressure. Two essentials to losing weight include moving often and eating well, which we'll discuss shortly. The DASH diet stands for Dietary Approaches to Stop Hypertension, and was specifically designed as a nutritional intervention to reduce blood pressure. The whole grains, lean meats, and healthy fats are similar to the Mediterranean diet, which also emphasizes fruits and vegetables. The DASH diet also emphasizes low-fat dairy as a healthy option. Red meat, sweets, and fats, especially saturated fats, should be consumed only in small amounts. On the DASH diet, you'll eat 6 to 8 servings of grains daily. A serving equals 1 slice of bread or half cup of cereal or rice. 4 to 5 servings of vegetables is recommended, with 1 serving being a full cup of leafy greens or a half cup of cooked or raw cut up vegetables. 4 to 5 servings of fruits per day will add some sweetness to your nutrition, but remember, a serving is 1 medium piece of fruit or 1 half cup of cut fruit. Each day you can eat 2 to 3 servings of low-fat dairy, like a cup of fat-free milk or a cup of low-fat yogurt. Be sure to check labels when choosing yogurt, as many include hidden sugars. When it comes to meat, choose lean options like chicken or fish, which also incorporate healthy fats. 1 egg or 1 ounce of meat is considered a portion here. That means if you ate 2 eggs and ate a 4-ounce piece of meat, that would meet your allotment for the day. When it comes to fats, shoot for 2 to 3 servings daily. A serving of fat equals a tablespoon of butter or oil. It is recommended that you keep saturated fat consumption at 6% of your diet or less, which would equal 120 calories worth or 13 grams per day of saturated fat on a 2,000 calorie diet. Saturated fats are those fats that are solid at room temperature. Most days you'll want to incorporate a serving of nuts, seeds, or legumes. 1/3 cup of nuts, 2 tablespoons of peanut butter, or half a cup of beans equals a serving. You'll notice that whole grains, fruits, and vegetables make up the bulk of this nutrition plan, with a supporting role from low-fat dairy, lean meats, and fats. Sugars do not need to be eliminated entirely, but it is recommended sugar consumption drop to 5 servings or less per week. Examples of a serving include 1 tablespoon of sugar, jelly, or jam, half a cup of sherbet, or 1 cup of lemonade. Although the original DASH diet caps sodium at 2,300 milligrams per day, the low sodium version and the American Heart Association recommend all adults strive for 1,500 milligrams or less of sodium per day. The typical American eats double the recommended amount of sodium each day at about 3,400 milligrams. Contrary to popular belief, most sodium comes from processed and prepared foods versus salting your food. The best way to understand how much sodium you're eating is to look at food labels and research restaurant choices. Most restaurants have nutrition information on their websites, allowing you to make an informed decision. In the picture, you'll note that the sodium on this label accounts for 19% of daily value. It's important to note that daily value is calculated based on a typical 2,000 calorie per day diet. If you eat more or less than 2,000 calories per day, the percentage value will shift slightly, becoming greater for lower calorie needs or less for higher calorie needs. When calculated, 5% or less is typically low in that nutrient, and 20% or more is considered high in that nutrient. Here you'll notice the sodium level of this food is high at 19%. Keep in mind that the values are per serving as well. If you ate 3 cups versus 1.5 cups of this item, the sodium would double to 38% of your daily value. In order to reduce sodium, choose fresh or frozen fruits and vegetables without added salt. When buying nuts and seeds, choose unsalted. Unsalted and raw is healthiest. Avoid adding salt to dishes and instead take advantage of herbs and spices. Be mindful of high sodium foods at the grocery and when eating out. Lunch meat, soup, dressings, sauces, and frozen meals are some of the worst offenders. However, even foods that taste sweet like cookies and other shelf-stable sweets sometimes include high amounts of sodium for preservation purposes. Getting in the habit of reviewing food labels and restaurant nutrition facts is one of the best ways to make informed decisions prior to purchase or ordering. Incorporating physical, regular exercise into your routine is a powerful way to support healthy blood pressure. It is recommended that we get at least 150 minutes of moderate cardiovascular activity or 75 minutes of vigorous cardiovascular activity each week. Double those numbers to 300 and 150 minutes for better health. Those who get over 300 minutes of exercise per week reap even better benefits. Examples of moderate activity include walking outdoors or on a treadmill, using a recumbent bike, shooting a basketball, or mowing the grass. Examples of vigorous activity are running, Zumba or other vigorous dancing, swimming laps, or playing soccer. And overall, it's best that physical activity be spread throughout the week. For example, 5 days per week, 30 minutes is better than 1 day per week for 75 minutes. Beyond cardiovascular activity, it's recommended we do flexibility and balance exercises like stretching, yoga, tai chi, or Pilates 2 to 3 days a week. Strength training should also be incorporated at least 2 non-consecutive days per week. If you do a full body workout, be sure to rest at least 1 day before lifting again. You can lift days in a row if you rotate muscle groups. Just be sure you're hitting all main muscle groups at least 2 times per week. Before beginning an exercise routine, make sure you discuss your plans with your primary care provider. If you are new to exercise or start back again, start with 5 to 10 minutes of activity and then gradually increase. Even 10 minutes of cardiovascular activity counts toward weekly cardio minutes. Creating a sustainable routine often means doing something you enjoy, too. Focus on exercise as play versus work. It's all in your attitude, right? And of course, be sure to stay hydrated during your exercise sessions. Tobacco use and high blood pressure increases the risk of heart attack and stroke, which are the number 1 and number 2 killer of human beings. If you quit smoking, your risks of hardening of the arteries, cancer, emphysema, and other lung diseases decreases. If you quit tobacco, your sense of smell is going to improve, and you're going to have more time during the day to spend time doing things you enjoy. The benefits of quitting smoking improve over time, too. Remind yourself of the rewards of quitting to help yourself stay on track if you choose to quit. Within 20 minutes of quitting smoking, your heart rate and blood pressure drop. 12 hours after quitting smoking, carbon monoxide in your bloodstream will drop down to normal. Between 2 weeks and 3 months, your circulation and your lung function will improve, and your heart attack risk begins to drop. After 1 to 9 months, you're going to be coughing less and you're going to breathe easier. After 1 year, the risk of coronary heart disease is cut in half. After 2 to 5 years, your risk of cancer of the mouth, throat, esophagus, and bladder are cut in half, and your stroke risk is reduced to that of a non-smoker after 2 to 5 years. After 10 years, you're half as likely to die from lung cancer risk, and your kidney disease and pancreatic cancer risk also decreases. After 15 years, your risk of coronary artery disease is the same as someone who's a non-smoker. Manage your stress. Stress is something that can be good or bad. Some sources of stress help us to be successful in life. However, too much stress is harmful for our bodies. You can prevent or reduce stress by recognizing sources of stress and identifying possible solutions for dealing with them. Planning ahead, prioritizing tasks, and preparing for stressful events are some ways to beat stress. Some stress is hard to avoid 100% though, so developing good stress management techniques is important. Some ways to manage stress include being mindful and aware of your emotions, regularly taking time to relax, getting active, eating healthy, talking with friends and family, utilizing proven stress management techniques like meditation and deep breathing, and building laughter into your day. Being mindful simply means using your 5 senses to notice things around you in the present moment. Take a deep breath now, in through your nose and out through your mouth. You can do this. Take a few minutes to think about the things we have reviewed today. Write down one small step that you feel you can do this week to reduce your risk for high blood pressure. Think about how the support you need and how you can support those around you that have high blood pressure. And remember, the Marathon Health staff is here to help. Schedule a health coaching appointment or visit us to discuss your goals. We can help you address behavior changes that will improve your health and well-being by setting realistic goals and brainstorming an achievable plan for success. There are free blood pressure checks as well as education and medication management at the Be Well Health Center. Step 1, meet with the family nurse practitioner, Linnea Ritter, me! Together we can further assess and diagnose your condition through history taking and lab work. Remember that lab work costs at the health center are covered by your employer, Cretex. Health coaching involves determining goals and then making lifestyle changes. The process involves a partnership and teamwork approach. I will walk alongside you and provide tools and resources you need to make improvements for a healthier you. I am open to alternative ways of reaching these goals that are unique to you. There are many ways to reach one's goals, and empowering you to drive the plan is crucial and very rewarding. Here are the references that were used to develop this program. Thanks for your attention. Be sure to subscribe. Have a wonderful Thanksgiving.